Hey everyone, welcome back to the channel. Today we're doing a collab with Mark Velasquez, who recently completed all of his pre-med work and is applying to medical school as we speak. I have no doubt that he'll be accepted, and this time next year, he'll be starting medical school. Today, he's been kind enough in joining us to talk about some of the insight that he gained as a pre-med, and so he'll be discussing the top 10 things that every pre-med student should know, and I hope you enjoy it.
Hey everybody, my name is Mark Velasquez and I'm a recent graduate from the University of North Texas, and today I want to talk to you all about 10 things that every pre-medical student should know. Make sure to give this video a like and comment down below for anything that stood out to you or anything that you would like Josh and I to clarify on. So without further ado, let's go ahead and go into my top 10 things every pre-medical student should know. The first thing that you have to know as a pre-medical student is that your activities after high school is fair game for medical school application. So unfortunately, the activities such as the shadowing, the leadership, and the clinical experiences that you do in high school doesn't really count. So if you just got that high school diploma, or maybe you're going into your first year of college, I'd suggest volunteering at the hospital, signing up, wanting to see patients, start your clinical hours early, or maybe you're someone who went to a high school that had a special program. For me, I was fortunate enough to get my certification in nursing assisting, so I was able to go into the hospital and some of the living centers nearby in my hometown. Go ahead and start looking at local clinics or hospitals in your area so you can get started. Maybe you just decided to become a pre-medical student. Maybe you had a different major in mind. Maybe you had a different route, a different track that you were on. It's important to reassess and understand what you're getting yourself into, such as the classes you're taking, the hours that's expected of you, and to really explain to others why you really think this is for you. So everything that you do after high school is fair game to the medical school admissions committees. So the second thing every pre-medical student should know is that you first start studying for the MCAT when you first start taking your first prerequisite class in college or in your undergraduate institution. Going into college, maybe going the traditional route, taking biology 1, chemistry 1, that's when you actually start studying for the MCAT. As you all know, the MCAT is hard and the MCAT is important. So by the time you're about ready to apply to medical school, you should just be reviewing. The MCAT is pretty much your final exam from all the prerequisite classes you've done. Instead of the content, you're actually extrapolating from these concepts and putting it into things such as research. Not only is it important to do well in your prerequisite classes, such as your biologies, your chemistries, and your physics, but it's also important that you're retaining that information. So right after the semester, when you're done with that class, that doesn't go away. You should still be able to freshen up, be able to recall the things you've learned, and you should first be able to build up on these foundations that you've learned in your prerequisite classes as you go into upper level science classes such as organic chemistry, biochemistry, and other advanced biologies as well. The third thing that every pre-medical student should know, especially when they're going to apply to medical school, is that their academic statistics are not everything about their application. Whether it's different schools such as an allopathic school or an osteopathic school, we all know that there's a certain threshold every student and applicant should meet. However, we must understand that medical schools are training humans to take care of humans. Just because you can do well on a test or do well in a class doesn't mean you're qualified to be a physician. So what I mean by that you're more than just your statistics is that you should be able to tell your story, your life story, maybe the activities that you're interested in. If you're interested in sports, music, art history, anything that just appeals to you and identifies with you, where you put most of your time in, you should be able to reflect why that is meaningful to you, because that is actually what makes you stand out. If you're familiar with the med school headquarters or Dr. Ryan Gray, who is the host of that YouTube channel, you are able to see a video where a student with a 528 MCAT and a 4.0 GPA was rejected from medical school. Why? It's because they relied on their statistics and they didn't really commit to these clinical experiences they had. There was a little bit of sprinkling of this experience, a little sprinkling there, but there's not really a true commitment to the field of medicine. So when you're writing your personal statement or you're writing the extracurricular activities in your application, be sure to list why it is meaningful to you, what you got from it, and be sure to explain how you can contribute to your incoming class. Fourth thing that every pre-medical student should do or should know when they're taking their college classes or doing their clinical experience is to always have free time in your schedule. At some point or another, we all experience something called burnout. So most of all, you're a human being at first. You don't have to dedicate your whole life to a career. You want to be treating yourself first, knowing that you prioritize your health, your mental health, your physical health, and just you overall. This means that you should be able to have time for your family, have time for your friends. You don't have to just be caught up with your grades or your courses and your activities. It's important to know that it's okay if you fail a test. In more sense, it's actually good in a positive way that you can learn from your mistakes overall. And this is something that medical schools can see overall, that they actually ask this in med school interviews. How do you reduce your stress? What do you do? Because without a doubt, medical school is not going to get any easier than college. You simply just get better at the whole school thing. So for me, I always like to spend time with my friends on the weekends or just whenever I'm done. After classes, I always have that gap in there. I always have a gap in my schedule, whether it's once or twice a week. I always know that whenever I'm stressed, or I know that leading up to a big test, that I have some people, some things to fall back on and to just really take care of myself. The fifth thing that every pre-medical student should know, at least to be competitive for medical school, is to start clinical experiences early. The best thing about starting early in your clinical experiences is that it shows commitment. It shows that this is something you truly want to do. And when you stick to it, especially for instance, you go to the hospital for volunteering, you constantly are surrounded by the clinical environment. You see patients, you see how the workflow is between nurses and doctors and other therapists as well. By putting yourself in that role to support patients and interacting with the workplace in the medical field will really show and help you stand out to why you want to be a doctor. When you write these essays, when you write your stories, it all must be backed up by your own experiences. The one thing that everyone gets worried about when they're applying to medical school is, how can I stand out? And the best way to really truly stand out is to be yourself. You don't have to emulate or show off any skills or sell yourself to anyone. You just need to have a story, have an experience, truly reflect on it, and tell why that has led you to become a physician. That is how you stand out. That is how you appeal to med school admit committees. So the sixth thing that all pre-medical students should know, at least do as well, is to continue their activities. What is something that appeals to you? Maybe you are a musician. Maybe you're an athlete. Maybe you love collecting rocks. Who cares? Still do the things that you do outside of being a pre-medical student. When I say that medical schools are training humans to take care of humans, it's also important to connect in some way. So with all these different experiences and what others do, it really shows that, you know, we're human too. That physicians are humans as well. They care about your well-being. They understand that you may have a family. They understand that you are wanting to get better. They want to get to know who you are as well. Share it with others. And who knows? You and your doctor at times may even relate to what you are doing. I know for me, and I know like Josh as well does this too, but I enjoy Brazilian Jiu-Jitsu. I enjoy martial arts. I like the aspect of self-defense and just it helps me keep myself in shape. And it's one of the things I like to do for de-stressors as well. I really enjoy teaching it to others as well. And for all you know, your extracurriculars, you can find a way to help patients with it as well. At least for me, when I really got accustomed to martial arts, I extended myself as a boxing instructor for people with Parkinson's disease and taught them the movements, the exercises that helped me as I learned martial arts. So it's something that I got to be a part of. Although you might have these responsibilities and commitments to school, your clinical experiences, please do not stop doing the things that you do. Do not sacrifice your activities for clinical experiences or for school. The seventh thing that every pre-medical student should know is to have friends, have people in your community, the pre-medical community, that are older than you and younger than you. When I was a freshman in college, I was a pre-medical student at the time, I walked into an organization, our official pre-medical organization at the University of North Texas. We called it the Medically Dedicated Students Organization. And I got to meet the president of the time. Him and I are now really good friends, and we like to support each other throughout our journeys as we become physicians. Despite the hard things, despite all these challenges that you have to go through as a pre-medical student, you never have to go through it alone. You have others that are doing the same thing that you want to do, but are just a little bit ahead of you. And also you have people that are younger than you that are wanting to get where you are as well. It's important to learn, but also the more that you learn, you should also teach to others as well. This is something that's very valuable to me, and it gives a sense of community. The eighth thing that every pre-medical student should know is that they should be journaling all their experiences. Without a doubt, your experiences such as your clinicals, your activities, your extracurriculars, you're going to be doing that for years. So by the time you apply to medical school, and after all the years that's been accumulated, you may forget some things that you want to tell or show what is meaningful to you by the time you apply. When I was shadowing, or when I was in clinical experiences or had these patient interactions, I had this small little notepad with me that I just pull out a pen and just jot it down, date it, and talk about why it was meaningful to me, what I did, how the doctor impacted me, and what I did, what I plan to do in the future overall. In this way, you're already setting yourself for a success in your medical school application. All those extracurricular activity paragraphs and essays that you're already doing most of the work by doing it early. When I was a volunteer in the emergency room at my local hospital, I was able to talk about these patients, what they meant to me, and what I did in return. As simple as just giving them water, telling the nurse that they needed help. It really meant something that I got to play a role in the patient care interaction and just me in the medical field, because one day I hope to see myself as more of an impact as a healthcare provider. So me journaling as a pre-med does not stop there. I truly believe I will still be doing it as I shadow in medical school, and myself as a physician. Physicians are always taking notes, they're always keeping things down, keeping details about their patients. So it's already a good habit to do when you're journaling in your clinical experiences. The ninth thing that every pre-medical student should know is that they should meet up with their pre-medical advisors and get to know where they are and get to meet them in their college campus. So this is where accountability comes into play. Right when you start becoming a pre-medical student, once you declare it, you want to know who your college campus pre-medical advisor is. So right when off the bat, when you want to take your first prerequisite class such as Gen Chem 1 or biology, you have an idea, a timeline at least, when you want to take the MCAT and when you want to apply to medical school. Also, they have plenty of resources for you, such as nearby hospitals to go shadow at or even volunteer at, physicians that are willing to let students shadow as well. I know for me, I was very fortunate enough to get to know my pre-medical advisor as a freshman in college. I would always take it a goal every month or 2 months to go meet with my advisor, so I keep them updated and I let them know what activities I'm doing, how I'm doing in my classes, and just what I'm involved in, get them just getting to know me as well. Some, but not all college campuses have a committee letter from advisors that they can write when you apply to graduate school. So it's very important when you get to meet these advisors that they already know what you're up to. They already know you in person. They don't need to look at other letters in depth to really know what to write in your letter for you when you apply to medical school. Pre-medical advisors don't specifically have to be from a college campus that are with the institution. They can be as simple as people who have got into medical school or current medical students They can be physicians as well, and they just overall help you out. They know the resources for you. Last but not least, and maybe perhaps the most important one, is to check out Medical School HQ on YouTube and on Instagram. As you all know, the host of Medical School HQ is Dr. Ryan Gray. He's an author, speaker, podcaster, and he's helped over thousands of pre-medical students get into medical school. He's seen over thousands and thousands of applications, and he's given advice, top tip advice, for how to write your personal statement, extracurricular activities, and just how to crush the interviews as well. I was very fortunate enough to meet him and bring him along to my pre-medical meetings over my organization at the University of North Texas, and he was able to answer a lot of questions from a lot of the students in my organization. I want to mention that he has 4 books that help pre-medical students get into medical school, and these 4 specifically are one for the personal statement, one for the medical school application, one for the MCAT, and one for the medical school interview. These all help pre-medical students navigate and really know what to expect and anticipate when they're applying to medical school. Alright guys, so those are my 10 things that every pre-medical student should know. If you enjoyed this video, make sure to check out my channel, Mark Velasquez, on YouTube, and follow me on Instagram as well at @MarkJVelasquez. And if you really like this video and you really like to see a lot of content with me and Josh coming together, let us know in the comments. Be sure to check out his channel as well and hit that subscribe button down below. Be sure to check out part 2 of this video series on my channel, where Josh gets to explain his top 10 tips for getting into medical school.
Alright, there you have it, the top 10 things that every pre-med student should know. Please join me in thanking Mark for taking the time out of his busy schedule to share those insights with us, and wishing him the best of luck moving forward with the rest of the medical school application process. If you enjoyed this video, head over to Mark's channel. We did a part 2 where I'll be discussing my top 10 tips on how to get into medical school. And then be sure to show Mark some love, subscribe to his channel. You can also follow him on Instagram. I'll go ahead and link those in the description. Thanks for watching, and I'll see you in the next one.